Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit. Delighted to welcome you to our Health is Wealth webinar. I'm joined by Mark Hempworth from the Good Economy. And we're going to get into the discussion today and really talk about how we bridge finance to projects initially in the UK, and then how do we scale that. Mark, delighted to welcome you to our webinar. Please, a short introduction for our audience, and really looking forward to our conversation today.
Thanks, Gareth. Really pleasure to be here. I know we've been talking for some time now, and now instead of talking between ourselves, we've got a much bigger audience, and I'm very grateful for that. I'm a co-founder and director of an impact advisory business called the Good Economy. We have two parts to what we do. One part involves developing impact advisory frameworks and services for investor clients. So we have about 70 private investor clients stretching across asset classes. And we have another half of the company, which is what we call collaborations. These are more public-facing, more policy-relevant types of work. We developed a sustainability standard for social housing in this country, and that is going great guns. We've got people from the financial world and housing associations involved, and there's the place-based impact investment collaboration, which we're talking about today. So we've been going about, I think it's coming up to 9 years. We have offices in Bath and London. We work with external partners as well as having our own in-house team of experts. Is that okay?
Yeah, and it's been about, I think it's about 3 or 4 years since we've taken us to get to this stage, but we've been really trying hard to bridge the gap between, the health sector. And Mark, you have a couple of slides that you want to go through with us. Perhaps we'll start with that. I'll bring them up, and you can give an insight into what we're trying to do in the UK.
Okay. So what I thought I'd start with. So I'm kind of conscious that I'm assuming a lot of people understand what the social determinants of health and the social costs of some of the things that we get wrong around health and what it means to our National Health Service and so on. So let me bracket that for a moment and simply talk straightforwardly about why I believe that health is the central plank and the cornerstone of building a new next wave, what I call next wave, knowledge economy in the UK. I think I'll concentrate on that and just explain why I think it's so important. And my first couple of slides are about that. So if we could start with that, because that then provides the rationale for why we've got PBI going, why we've got place-based impact investment going here. So one of the interesting things about the health sector is that when you look at the economic case for it, and the reason I'm saying it is absolutely the cornerstone of the next economy, is that if you look at the diagram on the right, particularly with the bubbles in it, the significance of it, this health sector and life sciences is in that blue color, that blue bubble. And the important thing about that is not only is it large in terms of the size of the workforce and its contribution to GDP, but it's also the most evenly distributed of all the sectors of the economy. If you exclude retail trade, which includes corner shops, high street shops and the rest of it, but it's not a productive industry. It's not a productive sector in the way health is. So if you are trying to reduce social and regional inequalities in particular, which, as you know, in this country, we call the levelling up agenda, effectively that is the sector, the key sector, if you want to level up. That's where you put your investment. That's what you should be trying to grow across the country. Okay. So because it's evenly distributed more than any other sector, and secondly, it's big. Okay. And it also half the workforce is professionally educated. Okay. The second thing about it is that it's multiplier rich. In other words, we've got anchor institutions in the form of the NHS all over the place, buying, procuring goods and services of all sorts. What we need to do with those supply chains and procurement is unbundle it more locally and unbundle it more in the direction of smaller companies and social enterprises. And then if you look at the bottom there on innovation, actually life sciences, which includes health, or health includes life sciences, is the most busy area for private equity deals in 2022. In fact, 25% of all the patents registered in the United States last year was in health. So in terms of innovation, regional equality, linkages to other places, and the sheer scale of it, it's important. The other really important thing about it is that we talk about it increasing labor productivity, the human capital perspective on this. But the really important thing to understand is that productivity relationship cuts across the entire economy, right? Wherever there's a worker, it matters that the health sector is functioning so that we have labor productivity. So it's the only sector that cuts across like that. Okay? Okay, go to the next slide, Gareth. All right, so this is actually my own personal background. My background was previously all about what we're looking at here is, let me explain this diagram first. These are the long waves of economic development across OECD countries, countries like the UK, America, and so on, and the rest of Europe, is that essentially what this is saying is that this is based upon work done by a Russian economist called Nicholas Kondratiev, who studied the movement of stock market prices over time. And what he discovered was that these markets moved in these waves, these long waves, 50-year waves. And essentially, what we're looking at the moment is the fifth Kondratiev coming to an end and the sixth Kondratiev taken off. And the sixth Kondratiev, which is about innovation, entrepreneurship, and so on, and skills, is a combination of the green economy, green technologies, AI, artificial intelligence, and the Internet of Things, but above all, health. And it is the first human-centered Kondratiev wave. So essentially what that's saying is the sixth knowledge economy, the next knowledge economy, which is going to change things in the UK and in other countries, is being driven along by health. And that's the key to my presentation, is to say we've got to build that because that's what's coming next, essentially. Okay, now let me just, we go to the next one. Okay, so place-based impact investing, which is what I lead here at the Good Economy, is basically saying the way this started was, what bothered me was, why have we got trillions of pounds and dollars in the financial markets? And why is it in the rest of the country we are looking for that kind of finance to support economic development? Why? Because we are now very close to some of the more tipping points around climate change, right? Secondly, we need to find a method of investing which actually allows everybody in the country access to sustainable prosperity, which actually puts it within reach. To do that, we've got to create good jobs, good homes. We've got to be putting clean energy infrastructure into place. We've got to have better housing, health, and we've got to regenerate places. And also we've got to do something with our natural capital, which also creates and helps economic growth, but in a way where everybody fairly and equally shares in that, the benefits of growth. So what we did was we put together that model. I put that model together. And it's essentially what the model is saying, how do we get investors, particularly impact investors, that's about 10% of the mainstream investment community at the moment. How can we get them to invest locally in our own backyards? How do we get them to invest in these types of private markets, real economy sectors across the country? And if we can do that, then we're going to be able to take some of that money from the financial markets and begin to start allocating it in a more socially efficient way and a more productive way. So that model over there has become very popular, but essentially place-based impact investing is, yes, investing for financial returns, but also in a way where you get impact in form of more resilient economies, more sustainable prosperities, and a net zero economy in the bargain. So we can deliver well-being on all fronts through these investments. So what I've been doing is working with investors, these are a lot of our clients, and working with local governments and other local stakeholders, of whom the NH Trust would be one, but we're sort of yet to do that. So most of the clients' moments are on housing, all right, and local government. So that is the model. And what I've done there is to put it next to the new approach to health in this country, integrated care systems, which equally looks at how we deliver health and finance health more effectively at the local level across the country. And so both share a place-based approach. And what we see generally across this country is local authorities and health partnerships and so on working closely together, housing associations and so on. So what I've done there is to say, look at the integrated care systems that we're now currently putting into place, with the NHS leading the way. And the objectives, if you look there, the aims of integrated care systems is pretty much the same as the PBI aims, the aims of place-based impact investment, and they're unified by place. So both are place-based ways of working together. So that's what effectively I've been working on with you, talking to you about, and so on. If you go to the next slide, what I've done there is I've been a bit cheeky here, Gareth. What I've done is I have taken from the NHS England document or King's Fund document, I can't remember which. This is the integrated care system area in Barnsley in the north in South Yorkshire, north of England. And then what I've done is put next to it, okay, the same area, it's the same geographical area. That's the geographical area which defines the local government pension fund for South Yorkshire, the same area. And what we've been doing is working with local government pension funds. There's now we have six of these clients, most notably Greater Manchester. And what we're doing with them is looking at how they could allocate more of their pension fund money to the local area. So what you're seeing on the right there are projects that South Yorkshire Pension Authority is funding. So the question I'm asking in a kind of provocative way, really, is are there pension funds within health that could also be doing something similar? Because that's our experience. We've got 6 different local government pension funds, and certainly the 2 biggest in the country. So that's why I put that there, because I wanted to raise the issue of how we could look at the pension funds in health alongside the pension funds in local government, given that these are the 2 partners in integrated care, the main partners. Okay, next one. I'm sorry if this is going too fast. I hope this is not going too fast.
No, this is perfect, Mark. This is perfect. Gives a great insight.
Okay, well, I hope so. Okay, so for the past year or so, what we've been running is what we call place-based impact investment labs. Let me use the term PBI because I use that all the time, right? So as PBI labs, we've had 4 running for the last year. And 3 of those labs, you can see the theme has been housing. In where I live, in Bath, northeast Somerset, it's a World Heritage City down in the southwest of England. what we've been looking at is how can investors help with developing housing for the kind of key workers like hospital workers, health workers, and so on, nurses and so on, because there's a huge shortage here. Like in a lot of areas of the country, there are shortages of these key workers, particularly since Brexit and everyone went away. Is that we're trying to find ways of providing housing that does that. Not easy, because this housing market in Bath is highly polarized. Okay, so we've got people with some people with lots of big houses, and we've got other people living on council estates and so on, and very poor private rented accommodation. But what we got is nothing in the middle. So it raises the issue really of how do you provide housing to get key workers to come to Bath, right? Younger families. The one in Manchester that you can see there, that was about the re-provisioning of social housing in central Manchester as part of a big regeneration scheme where the council is in partnership with the Far East Consortium, which are investors, developers from the Far East. You find a lot of foreign capital coming in to finance things like China in Sheffield and so on. But what we find is that less than 2%, right, of local government pension scheme assets are allocated within the UK. Less than 2%. The other day, I was talking to local government leaders in Birmingham, and I asked the question to the seminar there. I said, what percentage do you think of local government pension funds stays in this country, right, and gets invested locally? These guys were going, 40%, it's got to be 30%. I said, no. I said, it's less than 2%, right? Oh, I didn't know that. And then I said to them, this is an interesting one. I said, well, look, what if I said to you, I could demonstrate that I would find projects in this country in those various pillars I showed you in the model, all these real economy pillars, that could nevertheless guarantee you got the benefit, your pension that you want, right? To satisfy your needs. What if I could find that? Would you be happy with that? So we could take 5% of the, say, local government pension funds and put it into the UK, make sure it's in the UK. He goes, this particular one goes, oh, I'm not sure about that, right? I'm not sure about that. And that's what you get, okay? And one has to begin to demonstrate that these things are possible. So I've put that slide up there. By the way, in South Essex, the issue is housing retrofit. So it's essentially about how do we take this old, awful housing, not just social housing run by the council, but private rented sector. It's appalling. And we actually know how bad that is for the health sector, right? You know the health costs, right? Okay. So that project is about getting investors. So we've got Octopus Investments involved in that, but developing solutions to how we can retrofit this housing, but with the investors and developers working together. So it's bringing people together at the local level in a particular place. Okay, next. Oh dear. Okay, that is what we do in the good economy. Okay, so on the left-hand side, that figure is telling you we do a lot of work on good jobs. Now we know that one thing that creates mental and physical health problems is bad jobs. So we're involved with a couple of partners in looking at how do we get investors to get interested in the employment consequences of their investments. We do a lot of work on housing. That's our main strength. We're probably the market leader in advising investors on social housing and supported living and so on. You know, we've got about, 40 clients in that area. And what the thrust of our work is basically how do we create better housing, decent homes, right? Which basically can eventually lead, as you've said, to a much healthier population, healthy communities, and so on. We also do work with foundations like Johnson & Johnson Impact Ventures, that's in Africa. And then within our PBI reporting framework for local government pension funds, yes, there are investments in health and housing again. And I do think there's this huge link, massively important link between housing and health. And essentially, that's what I think all our place-based impact investing work is about. Next one. So I think, first of all, I hope that helps, that gets an idea of what we do. I would like to begin with, if we can do it, if we can find people interested in supporting it, is to essentially find out where we are now. Okay, where are we now? What are the investment needs of the sector? Very broadly, okay, but the ambition has got to be is to build the next knowledge economy, right, around health as a cornerstone. Okay, so what we do here, like we've done before, we did this with our PBI work to begin with the Impact Investment Institute, the City Corporation of London and others, is to start, first of all, by talking to investors, talking to people on the ground in the health sector, and finding out what's needed. What kind of investment do we need? Can we find case studies where things already work? And then develop impact metrics and methodologies which allow us to see what impact we're having, what impact we have with these investments, and then looking at that over time. Now, what helps to do that as a catalyst is to basically launch this cohort of PBI health labs. That's what you and I've been talking about. In different parts of the country. It would be good to have half a dozen, right, at least to kick off with, which will allow us to explore not just the idea of what I'm talking about, PBI for health, but how in practice could we be implementing it on the ground, and what are the barriers to that? So we have just finished our report on our own health PBI labs, which people are welcome to look at, and we can explain some of the barriers. Some of these are institutional rather than financial. Some of these, the way we do things now, which we need clearing up. So there's an incredible amount of institutional clutter. I normally use the term getting the elephants to dance, because I kind of feel that so much gets siloized both at the local level and also in the investor community, right? And then very clearly, it would be great to work in an international context for people out there. I've always done that myself. We do a lot of international work. In fact, we're going into Asia now. We already are in Africa. And as you know, my history is North America and Canada and Europe. So I think we can learn a lot, because there are a lot of cultural influences as well as financial influences. And what I'm trying to do is to say, if we're going to invest, let's invest alongside other policies and enablers which allow us to actually get things done. So I think learning from other countries very clearly is good, particularly since compared to a lot of countries, particularly in Northern Europe, we're really seriously underinvested, right? And then, yes, we could have PBI labs in other countries as well. No reason why not. And you know, it's already somewhere you're at the moment, Gareth, with your Healthy Cities network, and we could build on that. So take what we do in the UK and, you know, begin to not impose it on people, but see how we can actually improve it by working internationally. Okay. I think that's about it.
That's great, Mark. I think that gives such a great overview of what the intention is, what the plans are. I wanted to pick up, you've made so many great points there, and learning from other countries is key. I mean, we have a coalition that we've put together in the US, for example. We met on the sidelines of UNGA, and we're very much looking at how we develop this model in the US, for example. And then I've been earlier on today, I met with some colleagues in Japan and Switzerland, and I was explaining the PBI lab model and how we could scale that. So I think there is opportunities. The cultural differences, of course, need to be navigated. But I think also you seen yesterday, you know, the UK made the announcement around AI, and we are moving towards this knowledge-based economy, as you explained with the Condriff kind of, shall we say, next turn up. And I don't think there's any reason why the UK can't lead. And I think NHS needs the support, because we've had some of the conversations, and you mentioned the housing, the opportunities actually to deploy capital to support, you know, the nurses and the doctors who need the housing as an initial step. We've had that. Interesting, the 2% of local government pension funds, that's very similar to the 2% of multilateral banks money going into health projects regarding climate change. So it's a very similar figure, which is remarkable, actually. And then one of the things, when you talked about the cost of housing, you know, like I think we just seen a report earlier today, I read it, and you know, there's nearly, you know, over the last 30 years, the NHS, it's cost 135 billion in terms of housing, per housing. You know, these figures speak for themselves. And I think the economic model and the health, the one great opportunity that we have at COP, which is what we've been championing and what I'll get the opportunity to speak about, is the pension funds that you mentioned. And we have 46 million healthcare professionals out there who signed this declaration that they want change, and climate change is a public health issue, absolutely. But perhaps it's time for our public health institutions to look at their pension funds and mobilize that capital towards place-based impact investing, as you mentioned. And then I think if we could mobilize 1% of the capital into these new vehicles, we would be able to solve quite a lot of our problems. So I think from my perspective, there's a huge opportunity here in terms of, you know, PBI labs, and then bringing health, as you say, into this equation. We have to be able to bridge the gap between the financial sector, which, as you say, has trillions of dollars, and then locally, where they're looking to get, shall we say, the scraps, and how do they build bankable projects? How do we actually, you know, gather those projects locally and then bring the investment? So I think that's what myself and yourself have been trying to do. And hopefully in the next few months, we'll get these labs up and running and work with stakeholders. Mark, what are the ways that you see the next steps of this progressing? Of course, work with NHS.
I think, Gareth, what would be good is a couple of things. I think, you know, going back to what I was suggesting in terms of directions of travel, we should try and recruit about half a dozen integrated care system partners in integrated, because there are board and partnerships at local level. And in that conversation, it would also be worth looking at how local government works with them, because their local government has all the housing stuff, right? And the other anchor institution, of course, is the universities, the colleges. I'm just about to start a big project here with a university, and I think that, and also at Newcastle University, we're building health innovation neighborhoods. So we're working with them on a PBI lab. Okay. So we're doing two. So first thing, it'd be great if we could get 6 places, right, to become health labs, health PBI labs. And then the second thing, it'd be good if we could use your network to begin to start at least beginning to create those international kind of links with others to find out what's going on. In fact, there is a lot of interest in case studies and exemplars from other countries where perhaps they do it better than us. Okay. We have created something called a PBI network. That network has got like about 12 to 15, I think maybe it's growing quite a lot, of private investors interested in place-based impact investing. And we have got a similar number of people from the local government sector. But what we do need is, if we're going to make this work and get as much power into it as possible, so that 1 and 1 makes 3, is what would be good is if we're running that along with the health sector as well. I just think at this point, we just need to go from us talking to getting some action going with people.
Absolutely. Well, I think we are people who get things done, and I hope the audience has seen that, and we've kind of demonstrated what the opportunities are. I'm very much looking forward to working with yourself and the team to make sure that we deliver on this. What I've done is I've put our email addresses and our websites up on the screen so people can get in touch with us. Just a final word, Mark. Are you optimistic that we will achieve the Sustainable Development Goals? I know we're at a critical point. You mentioned climate change, but do you see optimism?
I mean, you've got to be optimistic, haven't you? You see, I think it's the strange thing about Sustainable Development Goals. We have been doing sustainable development in this country since I started working on economic development. That's the 1990s. So you're talking about 30 years. So we've got 25 years of failure behind us because that's not what we've achieved. Now, we've got 25 years in front of us to get to 2050. You can't afford to fail for the next 25 years. That's the point. You can't afford to fail. The second thing is, and I'm going to restate it, I think health should be the cornerstone of the next knowledge economy. And by that, when you talk knowledge economy, you're talking about innovation, you're talking about technology, you're talking about skills, and you're talking about backup from government, right? That's what we need. When I was writing about the knowledge economy, 25 years ago, 20 years ago, so I became the guru. I was advising the Prime Minister, the Chancellor at the time, and what we failed to do was to create a knowledge economy which spread across the whole economy, right? We didn't do that. It got hijacked, right, by the property industry, the financial sector more generally, and a global financial sector, and then also by the IT industries. Because if you look originally what the knowledge economy is about, it's far more democratic, it's far more spread. And if we're going to build a new knowledge economy house, you don't start with the roof.
Agreed.
You start with the foundations, right? And that's why place-based impact investment is not just about money. It's about the social capital, right, that we can bring together and build. And that is bottom-up thinking. And that's why I like the integrated care systems approach, sitting alongside what we're talking about on, what we're talking about when we talk about, what the health sector can do, the integrated care systems and so on. So if you ask me if I'm optimistic, yes, Gareth, I am optimistic.
Yeah, I'm very optimistic because I think we can bridge the health sector. I think together we'll be able to do that. I think we have the partnerships in place now to scale this up. And we've so many colleagues around the world watching what we're doing, and I'm encouraging them now to get involved, to meet with us, to discuss this, to take this to the next step. And also to work with those pension funds. I mean, I'm heavily engaged with our colleagues across the health sector. I've been speaking about this for for a couple of years now, and now is the time that we get the vehicles up and running, and we'll have some announcements at COP to make, which will prove that. I'm very excited, but I think it's very important we match that local economic value. One of the things with the World Health Innovation Summit, for example, Mark, is just the example of, when you have employment, for example, like a doctor's employment, when you bring that high value job to the economy, it's worth millions to the local economy because they buy a house, they send their children to school. And this is what I was trying to demonstrate locally here, that like if you attract the staff, then you employ the staff. For example, we've 100,000 vacancies in the NHS. That's a huge number of economic tax that we would gather. So it's all about the economic spectrum here and delivering that from a health and well-being perspective. One of the statistics that I've been looking at, in terms of suicide, for example, the cost is about 1.7 million. But as you said, the majority of that is spread outside in terms of the wider emotional impact on societies and families. And that's a huge problem, about 10 billion a year. So it's not just about the individual problem. So I'm really excited to be able to work with you, Mark, and the team at the Good Economy, and I'm looking forward to the next steps. We'll sign off on the Friday afternoon. We've had quite a lot of comments here from those who have really enjoyed the session. And what I look forward to doing is engaging further on this topic and actually, like you say, Mark, get these labs up and running. initially in the UK, but then with our partners internationally, be able to scale these. So from
Just
myself
to
and
let
Mark,
you know,
yeah,
Gareth, just quickie, last one, is that one lab, the labs are, there's a domino effect.
exactly.
So you know what's happened is that we're now doing a lot of other lab work with other people on different themes. But I would like to have this a kind of double barrel, kind of twin engine thing between housing and health. That's what I would really like. And housing, we are right up there, and you're up there on health, right?
Yeah,
And
absolutely.
yeah, and that's what we need to be doing. And I just hope, I'd love to hear from people about what they think about these things, and you know,
Yeah.
and hopefully out of this, that be people over there saying, "Gotta join, gotta have a lab in our area," right?
Well, that's the plan. I mean, I'm looking forward. We're going to meet a lot of stakeholders, and you mentioned Africa. You know, we're working with ICLI Africa, for example. We'll have a
Yeah,
session with them at COP. 350. They have 350 cities, Mark, in Africa. So that's what we're
yeah,
looking at. That's the sort of scale we need, because we do need that transformation. The other thing is the capital is available. What we need is the bankable projects, and we need the expert like yourself to bring those together, those stakeholders together. So, we'll close it out, but thanks for joining everyone on this Friday afternoon. And Mark, it's a pleasure to have you as a guest, and we'll talk very soon. So thanks, everyone.